Self-compassion for many of us is often misunderstood. These types of, compassion-focused therapies can feel like self-indulgence or weakness or being soft on ourselves. What would you say to veterinarians and others who are still hesitant or skeptical about engaging in these types of modalities?
So I'd probably start off by kind of just gently being a bit curious about what someone means when they're talking about self-compassion. And I guess are they kind of really genuinely understanding in its fullest form? There is that misconception, compassion being kind of thought of as easy, soft, a bit of a cop-out. It'd actually be to look the problem in the eye and actually start taking action that moves us forwards to alleviate this suffering cycle we're in. They require a lot more strength and courage than merely going home and having a bubble bath. Self-compassion is a real commitment and a long-term action. So I think understanding what self-compassion is before we dismiss it is probably the first place to start.
It can be really helpful to make that reframe. And I think self-compassion and admitting that we need help can feel like a weakness. And I think reframing it as a strength and actually taking a huge amount of courage is really important to make that reframe and to change that language.
And it's actually wise to seek help. Right? We are stronger together than we are apart. And when we're isolated, that's at us at our kind of weakest, isn't it?